British newspaper The Daily Telegraph has reported that Taiwan's COVID death rate may be unprecedented this summer. The report points to a sharp rise in local cases within a short period of time, from a few hundred to tens of thousands a day, and says this trend will continue. The piece also points out that Taiwanese have little natural immunity and that there are, quote, suboptimal vaccination rates. It also quotes an expert as saying the government was moving too quickly in easing restrictions and had not adequately prepared the public for the change. Let's hear what local doctors have to say.
The Daily Telegraph's headline does not mince its words. It says Taiwan faces the potential for lots of deaths. The report quotes Chase Nelson, an American computational biologist based in Taipei, as predicting that Taiwan could peak at 200,000 infections a day. In addition, it notes that 21% of people over 75 have resisted the jab. The report also points to an analysis last month in Taiwan's Commonwealth magazine that an estimated 22,000 older adults could die if vaccination rates did not pick up, basing its calculation on Hong Kong's fatality rates. With the government keen to open up to the world quickly, officials had missed an opportunity to communicate what they were planning and prepare the public for the surge, Nelson said. As a result, the report says there could be an unprecedented death rate by summer.
This scholar thinks we will have a large number of deaths. But in fact, according to the Hong Kong model, I don't quite agree, because at that time in Hong Kong, the elderly had not received as many vaccines as we did, and their so-called medical treatment capacity suddenly collapsed. Because of large numbers of confirmed cases, sudden outbreaks, and unpreparedness, large numbers of the elderly were packed in the emergency rooms of public hospitals. This is not the case in Taiwan.
Some doctors, like Lin, disagree with the British report and think using Hong Kong as a model for Taiwan is wrong. But other doctors think that rapidly easing COVID restrictions does not allow for enough time for sufficient herd immunity to develop, and that the government is being too hasty.
We are currently seeing that on the one hand, the Ministry of Health is planning more COVID wards through arrangements with various hospitals. But at the same time, we see that policy is gradually being relaxed, which will lead to two conflicting results. One is that patients will accumulate too rapidly. Many patients in need of treatment could have been infected at a later time, but in fact, the result is they will be infected with COVID earlier, resulting in medical institutions becoming overwhelmed. So I hope the CECC can consider the views from the UK. Some of what the foreign media reports said is actually true. The vaccine coverage rate for Taiwan's elderly is probably not the same as other countries with extremely low fatality rates. I think any opinion expressed by other people should be taken into consideration.
The CECC has settled on a policy of coexisting with COVID. The question is whether the speed it has adopted in relaxing restriction matches the speed it needs to go to minimise the impact of the pandemic on Taiwan. It's clear the CECC needs to carefully evaluate opinions from all quarters.